Yes, so after we have conducted the white light routine examination for the patient, nowadays it's mandatory to understand what's hidden, if at all, in the oral cavity. And for that we have the device called as a VELscope, which throws the blue light in the oral cavity, and then we have to capture certain things, if at all they are hidden and which were not noticed with the naked eyes. So for that, this is the VELscope device. The VELscope device basically is having a well cap which is attached here, which is changed for every patient. Then we have an iPod which is going to capture the images for us for documentation. So we are just going to start this iPod as well at this point of time. So we are going to collect and document the images from this iPod. Well, the well sheath is again a disposable and going to prevent the cross contamination for our patients. And for protection of the eyes, we are going to ask the patient to wear this eye protective lens. So with this, when the doctor is ready with the mask and gloves as the normal protocol, and we can directly assess the entire oral cavity. Now what we are looking up to in this is for any black spots in the oral cavity. So the blue light actually enters the upper cells of the epithelium, reaches the connective tissue and passes back. If there is no reflection coming out, as in this case, of any areas, the labial mucosa, the buccal mucosa, the tongue, the hard palate, the soft palate, the ventral surface of tongue, at that point of time, a suspicious lesion is developing in the oral cavity, and this is how the white light and the blue light combination is mandatory for every patient. What happens next? So we are going to scan all the soft tissues, the buccal mucosa bilaterally, the floor of mouth, the tongue, the labial mucosas, the hard palate and the soft palate. If at any point we feel that there is loss of fluorescence, we can actually capture it and store it for our further references. So why do we need this device to be used along with the white light? The simple reason is, if under the epithelium, if some things which are developing, which may take few years to surface it out, they can be captured by the VELscope well in time. And that's how it's going to be important to keep our patients and help in diagnosis of lesions which are not seen to the naked eyes. So that is the usefulness of this device called as VELscope. Thank you.